You're listening to Working in Oncology, a podcast and video show that spotlights oncology practice staff and industry influencers who work behind the scenes to shape the future of oncology. The more knowledge the oncology community shares with each other, the more we all grow. Let's get into the show.
Darin, welcome to the show. I've been really looking forward to our conversation today. I think that burnout is something we're all prone to as we juggle so many demands, especially with everything that's happening in 2020. And when I think about the added pressure of working in an oncology office, I know our listeners will find so much value in what you're going to share today.
Yes, I'm looking forward to the conversation.
Before we jump into the conversation, tell our listeners and viewers a little bit about you, your background, and what you do.
Sure. Well, I'm an orthopedic surgeon by training, and my area of subspecialty practice is in oncology, so benign and malignant bone and soft tissue tumors. And my journey to what I'm doing now really started back when I developed an interest in sports psychology in high school, and I read a little bit about mindset training at the time and tried to make use of some of those ideas back then. But as I got into college and med school training and starting my clinical oncology practice, I lost track of a lot of those skills, unfortunately, at the time in life where I could have used them the most. But nonetheless, that's how it happened. And about 5 or 6 years ago now, which was 4 or 5 years into my oncology practice, I became quite burnt out. I didn't realize it at the time, but looking back, it's very clear to me that I was becoming and then did become burnt out. Fortunately, never the type of burnout that led to any substance abuse problems. Fortunately, that never led to any patient care issues, but burnt out nonetheless. And the silver lining to it was it brought me back to those mindset training ideas that I'd learned about 25 years or so before. And I got back in touch with those ideas and was learning about them. Again, getting updated on it, only to find that field had really expanded a lot, both with the mindset training, with incorporation of meditation, sleep science, nutrition, exercise, and recovery principles. And in learning about that, it became a passion of mine to bring those ideas, those principles into the healthcare system, partly for treating patients and incorporating that into their care, but also for treating ourselves and each other as healthcare professionals, because these principles are used in many different industries to promote high performance so that we can be working at our highest level, but they also overlap with helping to reduce the risks of burnout, at least at the individual level. So I think that they're really important skills and habits to train and develop in all of us and to promote in each other.
It sounds like you're quite the expert on burnout. Today, we're going to talk about how to recognize and prevent burnout. And we're going to discuss mindset training and maybe a few tips and techniques our listeners and viewers can incorporate into their everyday lives to achieve optimal performance.
Sounds great.
Awesome.
Sounds great.
So burnout is a term that is used a lot in the healthcare industry, but what does it really mean? Can you give us a quick definition?
Well, I think the thing about burnout is it can manifest itself in so many different ways. I think that we all might have a different idea of what it means to say somebody's burnt out or are burning out. And certainly in the extreme form, we might all agree and have a very shared idea of somebody who is no longer finding fulfillment, enjoyment in the work that they're doing, somebody that might be depressed if it's very severe, somebody who might be more irritable or reactive than they might otherwise be, somebody who is detached from the work that they're doing, both with their patients as well as with their colleagues and partners. But it could also be a lot more subtle. And I think that ideally we would all have the skills in place to decrease the chances of ever getting burnt out, even mildly, and certainly would recognize it in ourselves and in each other, probably more likely in each other, because it's hard to see that in yourself before it becomes more severe. And we know that at the more severe end of the spectrum of burnout, it can really manifest into some serious personal issues as far as substance abuse, depression, suicide even becomes something, sadly, that becomes talked about. It obviously can have a big impact on relationships, both personal and professional, and then on professional side with partners and colleagues, as well as with patients. And so it can really affect every aspect of somebody's life.
The people who work in oncology practices usually work in high stress environments. It's really difficult to care for patients who are terminal, especially when they become like family. They work long hours and there's lots of demands on them. And then we have COVID. They're working with patients who are immunosuppressed and at high risk. It's really hard. So
For sure.
how can our listeners assess whether they're experiencing burnout or if it's just like normal everyday stress?
Well, that's a great question. And I think it can become a fine line between just the normal everyday stresses and demands and when it goes over that point to becoming burnt out. And I think that there's a few different ways that we can all address that issue of recognizing it as early as possible. And I think it starts first and foremost with self-awareness to try as best as possible to understand how we're doing, how we're feeling, checking in with ourselves, knowing if we feel like our stress levels are getting too high, if our fulfillment with our work is not what it may have once been. Are we feeling engaged and connected with our patients and our partners at work, or are we starting to feel detached? These can all be red flags for somebody who is developing or has become burnt out. I think another thing is that as healthcare professionals, we have to look after each other and have to be able to be comfortable enough to talk with each other about these difficult issues. And if we have concerns about this possibly starting in one of our partners, to be able to bring it up with them and to talk with them so that we can try to give them the support and help that they need. And then, of course, the ultimate is to put in place habits and skills to just decrease the risk of this happening in the first place, which I know we'll talk about through our conversation.
Absolutely. So why do you think so many of us overlook self-care and doing that kind of self-reflection and self-assessment?
Well, I think unfortunately in our culture and in our society, not just healthcare, but larger society, we are almost left with this feeling that self-care or looking after ourselves can be selfish. And particularly within the healthcare realm, we're really trained right from the beginning to prioritize patients, and rightfully so. But a lot of us get a message that looking after ourselves is somehow not doing our job properly, that it somehow is not prioritizing the patient to make sure that we ourselves are in a good place first. And unfortunately, it's just simply not true. We really cannot be of service to others if we aren't looked after first. In order to be able to do the best work we can for our patients, we need to be in a good place ourselves, mentally, emotionally, physically, spiritually, all of the different aspects to our overall health and well-being. And I think sadly, we're just not, in a sense, trained to think that way and to live that way. And it would be great to get back to being more centered on these sorts of ideas, because ultimately they will lead to us being able to interact with others, to empathize with others, to be compassionate to others, and to do our job to the best degree we're able if we do look after ourselves first.
I love that. So self-care is not selfish.
No, in many respects, it's selfless because it allows us to be there for others. And that's not just at work, it's in our personal lives as well, be it with friends or family, loved ones, children, whoever's in our lives. In order to be the best version of ourselves for others, we need to look after ourselves first.
What a great message. What are some of the dangers, do you think, of not engaging in self-care and overlooking that part of daily life?
Yeah, I think that's really important to talk about that. I think if we don't pay enough attention to self-care, we, in a sense, lose touch with ourselves and how we're doing. And that sets off, I think, a little bit of the potential for a cycle where things can start to deteriorate, get harder. Our ability to deal with stress is decreasing, but because we're not checking in with ourselves, because we're not looking after ourselves, that can slowly get a bit worse and a bit worse and a bit worse. And we don't have this mechanism within ourselves, if we're not used to doing self-care, to identify it before it becomes more severe. On the flip side, if we do have that practice in place of being able to really connect with ourselves and be self-aware, and we notice things are starting to slip a little bit, for example, not connecting with others as much as we typically would. We can sort of put the brakes on it and put things in place to get back on track. And there's lots of different strategies and skills that we can use to do that. And if we can train those skills proactively so that they're strong and ready to be used when we need them, it leaves us in the best place possible, because we all go through difficult times. None of us are going to skate through life with no challenges or obstacles or setbacks along the way. It's about how we bounce back from them, and having all of these skills built up as best we can in advance of those setbacks lets us work through them to the best of our ability.
So I have heard you talk about mindset training. To our listeners, can you tell us what do you mean by that?
Well, so the mindset training we're talking about, people might be most familiar with in like a sports environment, like sports psychology, and athletes doing this sort of training to have their minds at the optimal level for their performance. And we're talking about training skills like the ability to focus, the ability to refocus, to maintain optimism, to be able to self-regulate if we get too worried or too anxious. We're talking about the abilities to really manage distractions around us, to bounce back from disappointments or failures. And for quite some time, sports psychologists have been a big part of many professional and Olympic and amateur sports teams. But really, when we think about it, how different is it in the healthcare realm? As far as we're trying to also perform, do our job as consistently and as at high a level as possible for our patients. And so many of these ideas will work just as well in the healthcare realm as they would in the many other industries that they've been used for a lot longer time. And like we were talking about before, having trained these skills as early as possible allows us to make sure that they're as strong as possible for when those big challenges really come up. And in an oncology setting, in an oncology practice, they can come up very often. And we want to make sure we can, be at our best when those challenges come up. And frequently that starts with our minds.
Wonderful. So can you provide a few tips and tricks that our audience can use to manage their emotional well-being and prevent burnout?
Yeah, I think there's a few different big categories, and perhaps we can talk in a bit more detail about each of those. I think the mindset training is one of them. Training the ability, for example, to be optimistic, to maintain concentration and focus, and these sorts of skills can be very helpful. I think having a meditation practice of one kind or another, as there's different schools of meditation, is very helpful, very essential. By itself, it's not sufficient, but I think it is a necessary part to looking after ourselves so that we can perform at our best and also minimize the risk of burnout. That might be mindfulness meditation as an example. I think other aspects are more along the lines of recovery. And so this is something we hear a lot about, again, going back to the sports world. An athlete has a big competition, and following the competition, they recover so that they're ready to go for the next training event or the next competitive event, whatever it may be. But if one thinks of a busy clinic day in an oncology setting, there's a lot of emotional and psychological stress that goes on, demands that are placed through the day. There's even physical ones. And as a surgeon, doing big, long surgeries is an example. But as any type of practicing oncologist, there's a lot of physical demands as well. And if we don't recover, then when we go back to work the next day, we can't be at our best. So we do need to recover, similar to an athlete following competition. And those ideas, again, include some of the mindset training ideas, but also getting enough sleep, enough adequate nutrition, hydration, exercise. All of these principles are really important to optimize to the extent we can, so that each patient encounter we can have the best chance of being at our best. And so I would say those are the big categories: the mindset training, meditation, sleep, nutrition, exercise, and keeping track of our recovery following every day to be ready for the next day.
Got it. And by recovery, do you mean just an additional period of rest, or what do you mean by recovery?
So it's really making sure that our minds and our bodies have, in a sense, worked through and processed the demands of what we've just finished, so that so we can be ready for the next day. And it includes making sure we get enough sleep. It includes making sure our bodies are adequate nutrition, which in the present days with the COVID pandemic is even more important for making sure our immune system is working as optimally as possible. It includes getting exercise, because that is part of allowing our bodies and our minds to recover, is getting all of the benefits of exercise. And it includes using meditation and those mindset skills to help, in a sense, rejuvenate our minds and get our minds over the stress and demands that we've been through in order to be ready to go into the next day. So as some examples of bringing all of those together, I would recommend and suggest that we all have a meditation practice, and how that might be very different for different people because of their schedules. As an example, I tend to do 10 minutes in the morning and 10 minutes at night, but it can look a whole bunch of different ways depending on what works for people. About trying to get enough sleep, which most sleep experts would say is between 7 and 9 hours a night, which sounds almost impossible as a healthcare provider, but it is really important. Proper nutrition, making sure we're getting in as much whole food as possible and as much adequate nutrition, so that our minds and our bodies essentially have the fuel it needs to be able to work at our best. A regular exercise program that doesn't have to be that intense, but regular, ideally daily, but at least 3 or 4 times a week, some form of exercise to help our bodies recover. And putting all of this together into a daily or at least a regular routine, so that it becomes a habit and just a part of our schedule, is very important to optimize our recovery, but also by doing that to minimize the chances for burnout.
So many of our listeners have been neglecting self-care and neglecting themselves for so long. It's been at the back of their mind. They've been dealing with work, pandemic, homeschooling, all of these things together. So how do you recommend that we start to change our daily habits? What's a good place to start?
I think a really great place to start is just by taking a few minutes at one point in a day to have an opportunity to just focus on some breathing and to do even the beginnings of a mindfulness meditation practice. And it could just be a minute to start with. It could be a bit longer, but just a very small amount of time. So it's very manageable. It's not too intrusive in all the busy stuff that we all have going on, but it's enough to just slow everything down, to become a bit more self-aware and to start the self-care process in a sense. And I think if people can start to do that and make that a regular habit with even just a few minutes a day, one quickly sees the benefits of it and then can start to see different ways of incorporating this on a larger time basis throughout the day. And I wouldn't start by having all of those aspects we talked about, because that can seem very overwhelming to have all of these habits we're now going to add on to an already busy schedule. But starting with one simple skill like breathing, I think is a perfect start. And then we can add things on from there.
So maybe just a moment of quiet in your car before you go to work. No radio, maybe some silence.
Yeah, I think that works perfectly.
Yeah.
So there's lots of meditation apps that are available. I've done, a 5-minute, 10-minute meditation after parking my car before going into work. I mean, it can take a lot of different forms and durations of time. I think just getting started is the big obstacle.
That first step.
Yeah.
So how do you think that COVID has impacted our well-being?
Well, I think in many different ways. I think even for people who have not been directly affected by the virus itself, there's just so many effects because of the virus all around us. And that just adds to the stress level. And if we think of overall stress as being like a cup or a bucket or whatever you like to visualize, and liquid inside of it, there's so much pouring into it from COVID as a result of the disruption to our daily lives, concerns about the health of ourselves, of our loved ones, of patients, the added economic issues, the added difficulties if we have children that are now at home for school, the just overall concerns for humanity. I mean, there's so much uncertainty that it just can put a lot of stress on us very suddenly. It all came rather unexpectedly, very little warning to it. And we also don't know when it will be over. And so there's a lot of uncertainty, which brings with it a lot of stress. And so if we kind of think of that on top of the stresses we all had beforehand, it can be hard to manage all of that simultaneously, especially over the long duration of time that it's been. Depending where in the country one may live. I live just outside Seattle, so it's been over 7 months now that we've been in the midst of all of it. So that's a long time for chronic stress.
Yeah, I'm sure it's having an impact on our collective well-being as a society.
Mm-hmm. Yeah. Chronic stress is very hard on all of us, not just emotionally and psychologically, but physically as well. And so self-care becomes even more important in the midst of this ongoing challenges and stresses that come with COVID.
So our oncology teams are in a unique position to support each other. They're there in the trenches together every day. Can you give us some tips or techniques on how we can support each other during this time, just on our path, help each other on our path to better self-care?
Yeah, I think there's, depending on the teams themselves, there's many different ways. One is to just be checking in with each other and just asking how each other are doing. I think that we can also do a lot of simple habit building together, be it, before the day starts, about giving people a space, for example, to do a minute or two of breathing before the day starts, about bringing in maybe more nutritious snacks for people to have. A lot of times there's food around in a clinic team room or something, and then
fewer cookies, more carrot sticks.
The healthiest. Pardon me?
I said fewer cookies, more carrot sticks.
Yeah, something along those lines, just because the nutrition part is really important for our recovery and our self-care. And so helping build those habits that way is a way. I mean, maybe even finding ways to take time during the day for people to get 15 or 20 minutes to go outside and go for a walk and get a little bit of exercise that way. And I mean, I could imagine, depending on the personalities within the teams, you could even set up self-care challenges and, support each other that way by, everybody checking in to make sure that they're working on various skills or habits to help promote their own self-care, both individually as well as a group.
Thank you so much, Darin. This is a lot of information that hopefully our oncology practice team members will be able to incorporate into their daily lives and help to kind of reduce their risk of burnout and reduce their total stress in their lives. This has been a great conversation.
Yeah, that would be great.
Yeah. This has been a great conversation. For any of our listeners who want to reach out with any follow-up questions or just want to reach out to you, what's the best way for them to do that?
Well, I'm certainly available through social media platforms. I can never remember what they are, but there's links to Twitter, Instagram, and LinkedIn that are all on my website. My website is www.Darin, spelled Darin, Davidson, Davidson.com. And there's also contact forms on that website. If people have questions, that's probably the easiest way to get in touch is through that site. And I would definitely be very happy and look forward to speaking with anybody that has questions or wants to talk further about any of these topics.
Awesome. Thank you for sharing your insights with us today. We really appreciate you being a guest on the show.
Well, thanks so much for having me on the show, Alicia. It's been great talking about this important topic.
You've been listening to Working in Oncology. To ensure that you never miss an episode, subscribe to the show in your favorite podcast player. If you're listening in Apple Podcasts, we'd love for you to leave a quick rating of the show. Just tap the number of stars you think the podcast deserves. Thank you so much for listening. Until next time.